Okay, I think I'm live. Hi everyone, and like typically out of the blue, but also I decided that I will be probably posting in a group like a topic, what will be the life about, and this way, some of you will see what I'm gonna talk about, and if it piques your interest, the topic, you can hop on later on, or you can hop on live. It's all here saved. It's in a guide, so if you can go on the top of the group, you will see those menu, and you can pick guides, and every single life is just saved over there. And this is how it's gonna be from now on. There's already like 4 lives saved. This is the 5th one. And today I picked the topic that is lifestyle is a medicine. And before I move on to the topic, and I have notes created, so I will just I will go over some bullet points talking about them, and hopefully it's not gonna be that long. The thing is that I wanna, number one, tell you that what I'm sharing on this life or any other life is not in any kind of medical advice. Don't take me like giving you any advices. I mean, what I'm sharing, I've done many of that things, if not all. But what I'm sharing is what I learned and what I implemented in my life, and what I am doing and helping other people to get healthy because of all that stuff. So it's just my knowledge that I'm sharing, but also giving you an idea as what you can do, but don't take it as health like a healthcare professional that you still may need, and you should still consider. So before I move on into all my notes, I want to give you kind of idea about a word lifestyle, because moving on to the whole topic, lifestyle is a medicine, I want you to understand the first part, which is very important. We all have a lifestyle. And I had a lifestyle before I changed my lifestyle to the one that is today. And I want you to understand that, like, being a smoker, it's a lifestyle. Being a drinker for, alcohol or some kind of, specific drinks, it's a lifestyle. So whatever you do in your life, you are creating your lifestyle. The only thing is it healthy? So I can call it like my lifestyle from the past was like a Polish lifestyle, and I thought I do healthy cooking. It was learned from, grandma and my mom, just was carry on through the generations, and I would never consider something like that not being healthy. But so many things I will be sharing with you today. It gave me so much questions. Why am I constipated? Why am I overweight? Why? Give me a second, because I have a guest visiting. Oh no, it was my dog just opening the door. I thought it's my daughter, so I hope my daughter will just close the door after the dog. She just left the room. So going back to my topic, I was just asking myself, learning about healthy lifestyle, what is wrong with my lifestyle that I was running, that I had, problems. Like there was always something with my body, and like I was tired or not sleeping, or like oversleeping or sleeping during the day. So that will be a question. Are you having a healthy lifestyle? So lifestyle is everything you have today, and maybe it is healthy. Maybe you are, I'm not saying perfect, but maybe you are feeling healthy. Maybe you don't see or feel anything that I will be sharing about. But if you do, And I will be sharing some stuff that you feel like, oh man, that's not the best way to go, and you would love to change that. That's something to consider, to have a lifestyle that is a medicine. So let me move on to the notes that I want to share. Let me see. So many chronic disease, and I believe I had, are created by a lifestyle we have. So that's why I wanted to just give you an idea, like how the lifestyle could create for you a chronic disease or be a medicine for you and create a healthy lifestyle for you. So like nutrition plays a huge role. Physical activity plays a huge role. Sleep or like rest plays a huge role. You know, stress, environmental stuff. And I was talking about that a little bit yesterday about toxins, detoxification. So that's environmental stuff that we have all around. So influences for a lifestyle that we can absorb, like from our grandparents and parents, and those are creating our lifestyle. Question is if this is healthy. Prevention and lifestyle, those are two different things. Prevention medicine is, I would just read that because that's what's internet says, so I want to be like more proper in the language. Focus on the health of an individual person, or even community, because prevention medicine, especially when you go and do your medical testing and you will get the results, those are basing on a preventional medicine. And they are defined also by population. I don't know if you know that, but it's to protect, promote, maintain health, well-being, prevent diseases, disability, and the death too. So lifestyle medicine, that's something that it's in the evidence-based practice of helping individuals and families to adopt and sustain healthy behaviors that affect health and quality of life. And the one thing that I catch right away, it's like on a little lower, smaller level. It's on like an individual, one person or a family, that we want like a lot smaller group of people to get the orientation about the healthy lifestyle, about lifestyle as medicine. Why is that? Because it's concentrated on a person, and like I can tell you about me and my household and how I created this healthy lifestyle. It's that I was working for myself, with myself, but I was implementing all that stuff that I was learning into my household. So I wanted my husband, I wanted my kiddos to eat the same way. I was learning it's a healthy way. Why? Just simply said, when I learned it's unhealthy, why I would wanna feed my kids the same, feed not healthy stuff. So conventional medicine versus lifestyle medicine, it's a huge difference. I hope this noise off of my dog is just not bothering you too much, but that's her lifestyle, just grabbing a bone and running around the house with the bone. So conventional, I will give you a couple ideas like to see the difference, because it was an eye-opener for me too. And I was going to the doctors many times for every single reasons I had. The thing is that they never were fixed. I was going into deeper problems. The problems were piling, like, getting one off of another. And same with the medications. I was piling on medications. So conventional medicine treats a person on the risk factors. We get tons of questions like, what is your family, this and that? Like what was in your family, in the past. But lifestyle, healthy lifestyle medicine, the lifestyle that is a medicine physically, treats your lifestyle that it's causing the problem. So we are looking for what is causing the problem and just eliminating it, so you're not gonna get into deeper problems. Conventional medicine, it's oriented on a patient, so like an individual, a person, for the care of that person. So it's just orientation on the care of that person. But lifestyle medicine is patient is an active partner in the care. So I love to say, and this will come back again in some other comparison, like your health is in your hands. It's nobody else's decision and choice, and participation in your health is in you. I knew I can change if I change me, but nobody could do it for me. So like treatment and conventional offers for short-term and active as well treatment, that's the conventional medicine. But lifestyle medicine treat for a long term and requires a person to make big changes. That's why it's shocking. That's why it's not popular. That's why it's like something that it's just scares people. But I will be honest with you, if you want to change, something needs to change. So responsibility in the conventional medicine falls into like the clinical studies. The responsibility falls into like studies pretty much. So we are responding in what overall, like I said, population is creating. So we are we are responding to this. But in the lifestyle medicine, responsibility falls into me. So like I said, your health is in your hands. That's your responsibility to be healthy. None of the other people, and for sure not the community you live in, or even the studies that they do because of this or the other health problem. So conventional medicine, it's a medication and procedure as an end treatment. So you need this in order to fix the problem. But with lifestyle medicine, medication, if needed, is an is just additional life change, that it's just if needed, an option for you. And I've been there. I was going through all the changes that I needed to create for my own health, but for some points at the beginning, at some stages, I needed some medications if needed. So take this in consideration. This is what I was saying at the beginning. This is no medical advice, what I'm giving to you, because if you need medical advice, you still go. So conventional medicine is emphasizes on diagnosis and prescription. And I will be honest with you, going for a correct diagnosis, like learning about your body, what's inside, just all of those tests that we need to do, not only blood tests, but anything else. It's very important. And based on that, you know what to change. You know what is causing the problem, or at least you can figure it out, what is causing the problem. So lifestyle medicine, it's putting an emphasis on motivation and compliance. And that stuff is something that was huge for me. And I can tell you one thing, whoever I am helping, they come for the change. They come for the lifestyle changings because they are already sick and tired of being sick and tired. I've been in this place. So the motivation comes from being done. I'm done. I'm done with everything else I was trying, and I just want and need to change. So the one more thing that I want to share between conventional and lifestyle is the goal. The goal is to manage the disease. That's the goal in the conventional medicine. And in lifestyle medicine, the goal is, what is your primary goal? Then what is your secondary goal? And tertiary goal. Like, we are not preventing disease. We are setting up goals to help you eliminate the problem, and we are doing it step by step. So goals are something that you going to create, what you can achieve, and those are the steps that you going to go for. Like I'm saying, primary, secondary, and they will be just showing up. They will be just giving you bigger power to accomplish stuff that you want to accomplish. Have you ever heard? It's Hippocrates. He said, let food be the medicine and the medicine be the food. Have you ever heard this? And that's what something that it's from, ages. And that's a wisdom. That's a wisdom that we can create our lifestyle, the food we are eating, the way we're going to treat our body. And he said it in one sentence, and that's the way to go. That's a wisdom that we can go for only and only. So what lifestyle requires? Those are a couple points, and I already mentioned them, but I will just repeat. Those are like, nutrition is important, physical activity is important, stress management. So everybody has some kind of stress. Guys, I am stressed out standing here in front of you and recording this message. So it's like having a rest, having a sleep, meditation, and I love to rest. I love to sleep pretty well, and I do. And I love the meditation. So being conscious about how you're gonna act on your own stress, having those ways of unstressing your body, it's a lifestyle. And social support systems that will just, help you with the environment that you are connecting this, and you are joining the environment that will be healthy lifestyle. So this group is one of the social support for you. If you are here and you are watching this live or recorded, and you wanna get more, you will be probably digging into the topic more, like I was. So it's really, really the support that you can get and that you can grow from is really important. And it was important for me, and I know I'm helping hundreds of people. It is important for them too. It's just, you are never alone in creating this healthy lifestyle, in getting healthier yourself. So why do we need this today? I will go and give you a couple statistics. They are sad, and I have a feeling that they are even worse today, but I'm not going to check the new data because I just don't want anybody to get down. I am already down by reading all of those up. The extra stuff is showing up. So I am already feeling pretty down going through and reading some that I found. So number one, many health issues are related to a lifestyle focus. So what we are focusing on. And like I said, everything, it's a lifestyle. Like, smoking, drinking, not exercising at all, toxic environment at work or maybe home, driving a motorcycle or a car, walking. It's a lifestyle. It's our decision how we live. Can you imagine all of those lifestyle are causing death? So tobacco is causing 3,500 people that they will die because of tobacco. Poor diet and lack of physical activity is 400,000 people. It's similar. It's exactly similar. So tobacco is the same, like your decision what you eat and if you have any physical activity or none. Alcohol causing about 85,000 people to die. There's like driving, motor vehicles, people are dying. That it's about 43,000 people. Drugs and all of those issues that people are just simply using drugs, too much, 17,000 people. So every single thing we do, we decide a lifestyle to choose is causing illness, disease, or even death. So with that, lifestyle influences all of our behaviors. And this is what I'm talking about: smoking, driving this or that, like alcohol or drug usage too much. It's all influence our behavior. So 1 out of 5 adults smokes. It's huge. I was shocked. I thought it's less, that it's already going away, but looks like it isn't. 2 out of 3, and that's huge. Just imagine this. Balloons? No, I don't want to have any balloons for that. But 2 out of 3 adults are overweight. It's a huge percentage. I have no idea if you understand that. 1, and I will get probably just in a second all of those stuff going on. So about 1 out of 4 people are, because of the behavior they have, they use nutrition as a lifestyle to lose weight. So 1 out of 4 adults look for a lifestyle to lose weight, which I would say with the 1 of 2 being obese, that's not enough. And 3 out of 4, so it's like a huge percentage, 3 out of 4 adults, they don't get recommended physical activity at all. Guys, it's crazy, it's sad. And one more that I found: 1 in 3 adults exceed recommended alcohol intake. 1 out of 3. That's a huge percentage level. And total, what I found, 33%, and it was based on US population, 33% of adults had healthy levels of 4 lifestyles, behaviors. Those are the lifestyle behaviors that I was talking about. So 33%, it's like 1 adult on, let me calculate that because I have this without the specific number. Let me just calculate that for you. It's to be exact, 1 out of 32, 1 out of 32 people has 4 lifestyle behaviors that I was talking to. So it's crazy. It's like really, it's crazy. And all of that, if it's just not about us, I want you to give you some idea. if it's not enough that it's all about us, but all of those diseases that, lifestyle we have, it is very much correlated with world, how the globe is reacting to that. We are causing those chronic diseases, or our lifestyle is causing problems in globally, in the world on itself too. So the second thing that I want to share about is health is causing the health cost of a current system are completely unsustainable. And I hear this a lot, that healthy lifestyle is expensive, or the most I hear, honestly, I can put in this sentence every excuse I'm getting, but US is the highest cost on your health care, not the healthy lifestyle. The most money Americans spend is the health care, not the healthy lifestyle. So healthcare cost is simply growing and becoming higher of anything. The lifestyle medicine that in the US people are spending on a yearly basis, it's going over $33 billion on every single year for the health care cost, which comes from diseases, cancers, strokes, diabetes, all of that stuff. So it's $33 billion a year for your healthcare. I am, for the past 10 years, with a healthy lifestyle, and I can tell you that this industry of a healthy lifestyle, nutrition, what I do is not that expensive, is not that big yet, and I honest to goodness hope it will, because if I will be spending with all of the Americans $33 billion on a yearly basis for my health, I will, with no doubt. But when I think about how many people are putting money into healthcare, and they are thinking that going healthy lifestyle is expensive, it's mixed up. It's nicely said, mixed up. And it's really hard to even explain until you try, until you see, until you, honest to goodness, participate in this other side, and you will see that it's not. The third thing I want to share, patients and providers are unsatisfied with the current approach. And that's probably not surprising. But it's not only me that I'm not happy with providers, and I know tons of doctors that are not happy with the system. They are simply not happy what system is doing with us people, where doctors are people. They are themselves not healthy, not taken care of well. So it's the fundamental changes needs to go in a different directions, because honest to goodness, it's just the healthcare system is not supported. The healthcare system is not liked by people, or even the doctors on themselves. And the last thing I want to share is that a need for a focus on a lifestyle is an evidence support that lifestyle medicine works. And I will give you ideas that it works. I mean, it's not only me that it works, because I am helping hundreds of people, and it does work. But the evidence is clear. It's a research that is showing already about that it's possible to prevent a lot of diseases, that addressing diseases that are already a problem, we can reverse them. That we manage chronic diseases, but not in a way that we manage the disease. We work on the reasons when they are showing up, and we are stopping the reasons, and then there's no chronic coming up back again in the body. So those, the biggest there are in America are cardiovascular diseases, and that's probably not surprising. But all of the, things that are coming into helps, it's like I was saying before, giving you an ideas, giving you support, returning at your decision into your power. So it's like creating communities or giving, giving you a decision, how, like you are making a decisions, what would you like to change? What is the thing that you want to change? What else I wanted to share? I think that's all. I just would love to summarize this with maybe one sentence. Let me see. Lifestyle practices. So it's a creating habits between people, like, and it's on a small level, like one person, then it goes to the family, and it will probably go into community, obviously, but it's the most important thing that will create the health, that will simply create the health. Changing the behaviors that we have and building better fundamental information about what we can care for our health. It's disease prevention, health promoting, and is just giving you all the strength that you can achieve, that you can accomplish. So let's the patient set the tone. What is your health way, health goals? What is the way you want to achieve that? So let's you decide, not somebody for you. Take small steps. Be specific. No, Ayla, please. Be specific. And just move on forward. Make some small changes and move to another step and make a decisions. How would you like to create this? And focus on the strength, because you can do it with the support, with them, the person that will be helping you and hold your hand. Like, this is what I do for people, that I build the communities that they are staying connected. So the strength you are not getting from yourself. You will make mistakes. I made tons of mistakes. I was making mistakes and I was just learning from them. So it's something that you can create. It's on your own, in your own power. It's in your hands, as I said. So lifestyle is a medicine. And it could be, the prevention, like the destroying your body, but it could be also building up your body and just giving you a lot of health. It's just the question, what lifestyle you are going, or you have, or you're going to create, or you're going to decide to live. I invite you to the healthy lifestyle. Watch videos I will be doing. I will be sharing. I hope this will be beneficial. You can ask questions. You can ask questions under the lives. You can message me via Messenger. Just, I am here for you, and having you into the conversation, having you into the comments or likes, or just, asking me questions, we will create something. I will help you to create your own healthy lifestyle. The thing is that I am here for you, for myself too, because I still create that. I still go through my life to be healthier, to be better for me and for my family, of course. And it's just spreading. It's just not my kids and my husband. It's also my parents. It's going into, my sister. It's going into her family that I'm helping too. And it's for you too. So just, communication that we can create, and I will be just, making lives possibly that will be in the topics that you want to hear, that you want to participate in. Let me know, ask me questions, and then we go deeper into the levels, into the topics that you are interested to hear. Thank you so much for today. Thank you for watching, recording, whenever you will be watching it in the future. And I will probably hop on tomorrow for some other topic. If not, it's a weekend coming, so it's very possible that I will be back on Monday. So have a good weekend. See you next time. Bye.